back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman here, coming to you from remote. We are not at the Capital Region International Airport in our studios, but we are in mid-Michigan, and we're going to stay here for a minute. We're going to spend a little time with Sarah Scranton. She's the executive director of MHA, which is the Michigan Health and Hospital Association Keystone Center. And Sarah, it's great to have you on. Happy holidays. Let me start with that, and welcome to the show.
Thank you. Thank you. Happy holidays to you too. It's good to be here.
Sarah, let's talk a little bit about Keystone Center and describe to the audience, if you would, what that is and how it works alongside hospitals.
Absolutely. Well, as you mentioned, I'm the executive director for the MHA Keystone Center, and we're the safety and quality improvement arm of the Michigan Health and Hospital Association. So that means that we work alongside our hospitals and health systems to create programming and processes that save lives by improving the delivery of healthcare.
Excellent stuff. All right, can you provide us a little bit, high level overview of a few areas that your team actually prioritizes?
Absolutely. For the past few years, and I can see probably into the future, we have several different pillars that we work under, behavioral health being one, harm prevention, health equity, and workforce safety and well-being. I'm sure none of those surprise you. They're all, big topics. But I thought for this audience, it might be good to dive a little bit more into the workforce safety and well-being. As you know, there's many factors and conditions that must allow effectively to enable patient safety, and that also includes capable, motivated, and healthy healthcare workers, which is something that we take a lot of pride in. However, the safety and well-being of healthcare workers, I'm sure no one is surprised, has been under attack lately, especially since the pandemic. And so therefore that impacts their ability sometimes to provide safe care to patients. Several ways that we've helped do that at the MHA Keystone Center is partnering with businesses in this arena. HSS is one of them. They're a security organization. And through our partnership, we're able to offer free physical security risk assessments to our hospitals, which is something that's very important. One of my absolute favorites that we've been able to do too is partner with Duke University's Center for Healthcare Safety and Quality to bring in their Well-Be program. And this program is designed to support the emotional well-being of healthcare workers. And so we've offered it, again, free of charge to our hospitals and health systems. And I'm really proud to say that over 6,000 healthcare workers in Michigan have already went through the training.
Wow. And this stuff, some of it seems obvious where you're working, but the fact is that if you don't get in there and point a finger at it sometimes, it gets lax or lenient or whatever. So talk a little bit about, how important this stuff is, from the standpoint of why your work is important to patients and business community.
Absolutely. Well, we've been around for 2 decades, so we're really excited about that. And through that time, we've worked alongside the healthcare leaders, patient caregivers, safety, quality, and risk practitioners. So the whole gamut of the healthcare industry to create these life-saving programs that have really impacted tens of thousands of patients, as well as healthcare workers in our state. I always like to note, hospitals are the anchor institutions in communities. So it's very important for us to be involved, not only with our workers and workforce and patients, but the entire community, because we have to work together if we want to create change.
Everything that I've heard is your Keystone Center has been pretty much a catalyst for collaboration among healthcare leaders and workers for the past 20 years. How do you plan to bring additional voices, I guess?
Yeah, well, we're really excited and planning for the next 20 years. And, we look at the MHA Keystone Center as a collaborator, as a convener, not only within our membership, the hospitals and health systems in Michigan, but also other industry leaders. And the workforce safety issues that I mentioned is one example of how we've done that. And if we want to create the change and move Michigan and the rest of the country into the future, we need to make sure that we expand our circle and work with everybody that is in a community to create positive outcomes.
Well, and the health of a community is so important to business. I mean, we're talking about, at the end of the day, days off work, that kind of a thing. So there's an economic education. How are you going to get business leaders to support the work that you're doing?
Well, yeah, I mean, that's a great question. And we work on that through all of those pillars that I mentioned, because we really value the cross-sector collaboration. We've learned through our past experiences and what we're doing now that in the future, we need to create more of those. And so we plan to keep doing that in the communities that we serve, really form these partnerships that are strong, that involve all the facets of that community to move that community forward. And the best way that anyone could stay connected with us, if they want to partner with us, we welcome that. You can follow us on social media, on LinkedIn, or you can look up our website to find more about the Keystone Center and sign up for our newsletter at MHAKeystoneCenter.org.
Well, Sarah, you guys do wonderful work, and this is just another service your association brings to your membership. And I guess we're all grateful, quite frankly. And sometimes you do this work and you don't get a ribbon the same day, right? And
Isn't that the truth?
Sometimes it goes unnoticed, but it is an advantage that you're doing it. So thank you very much. And thanks for making time for us today. Happy holidays. Sarah Scranton, Executive Director of the M.H.A. Keystone Center. Keep up the good work, Sarah, and again, have a good holiday.
Thank you. Same to you.
Watching the Michigan Business Beat on the Michigan Business Network. I'm Chris Holman.